Hello everybody, I'm Dr. Asi Perez.
I'm Dr. Eric Perez.
And welcome to another episode of the Good Locks Docs podcast.
Welcome to the Good Locks Docs podcast.
Today we're going to talk about finasteride, what it does, and how it reacts within the body.
Finasteride being the most effective hair loss treatment out there.
Yeah, we've got two effective therapies, medical therapies, that's minoxidil and finasteride, and they're the only two that actually really work, and finasteride is number one of the two. We almost always recommend finasteride to our hair restoration patients.
Why is that, Asi?
Well, that's because finasteride actually addresses the root cause of the balding. And if you want to know more about the pathophysiology of male pattern baldness, listen to our previous episode. But a brief recap. So, testosterone in the body is converted to dihydroxytestosterone by an enzyme called 5-alpha reductase. Now, dihydroxytestosterone is a lot more androgenic than testosterone, okay? So this very potent androgenic hormone goes and it signals your genetically prone hair to miniaturize and form vellus hairs that make it seem like you're bald.
Genetically prone hair meaning the hair on top of your head, not on the sides.
Exactly. So a lot of patients come to me and say, Doc, I've been taking these medications and they're not quite working for me. Well, I always say to them, firstly, how long have you been taking them for?
Generally, it's less than 6 months.
Exactly. You need to be on them for at least 6 months. And secondly, what exactly were your expectations from taking these medications?
You're not going to grow back a full head of hair.
Exactly. You're not going to grow back your afro. But, and most importantly, you're going to stop progression of further hair loss.
Meaning that the hair that you have on your head right now will probably stay.
Exactly. And we can get into studies of that soon. Dr. Russell Knudsen actually has a great analogy about this. It's called the leaky bucket theory. And what that means is you start life with a full bucket of water. A male pattern baldness starts punching holes at the bottom of this bucket. The water slowly starts to leak. What finasteride does is goes and it plugs up some of these holes, or all of these holes in some people, and
basically maintaining the hair that you already have.
Exactly.
A lot of patients are concerned about what's happening to their testosterone levels while on finasteride.
Yes, well actually, while you're on finasteride, testosterone levels increase by about 15%. But don't get too excited, because this actually does not cause an increase in total androgenicity within the body.
Yes, this is because DHT is far more androgenic than testosterone is.
So by taking finasteride and blocking DHT, you're definitely going to reduce the total androgenicity within your body.
The good news is testosterone will pick up the slack, and most people will not experience any side effects.
The most common side effects of taking finasteride are a decrease in libido and a little bit of erectile dysfunction. This only happens in about 3% of patients, and in our experience and a lot of our colleagues' experiences, as soon as finasteride is discontinued, the side effects stop.
We know that these side effects can cause significant amounts of distress, but your doctor should be with you the entire way. You can lower the doses and you can actually find that sweet spot where you're not experiencing any symptoms, but you're also getting the benefits of not losing your hair.
Exactly. Customized finasteride dosing. And we'll get into that in our next episode.
So let's talk about some of the studies.
So there was a few large double-blinded, placebo-controlled randomized trials that were done, and they showed some interesting results. So they took a placebo group and a group taking finasteride. After 1 year, 86% of the finasteride group kept their hair versus the placebo. After 2 years, that number dropped to 82%, and after 5 years, that number dropped to 67%. Now, that doesn't mean that the rest of the people completely lost their hair. It definitely slowed down the progression, but it does mean that if you take finasteride for 5 years, you have a 2/3 chance of keeping the hair on your head exactly the same as it is today. So Eric, tell us, how long do you have to take this medication for?
I always tell my patients that you just take the medication as long as you really care about your hair.
Exactly. So, I mean, if you're now 40 years old and you have a family and your balding doesn't really bother you,
And you sort of look good with shaved hair.
well then stop taking the medication and let nature take its course.
Also, when you get to a later age, your hair loss progression might decrease and you might not lose as much hair.
Yes, quite correct. And finasteride is also a very, very safe drug that has almost no interactions with other medications. So you can keep taking it and it's not going to be a problem. Do you need any blood tests before starting finasteride?
Look, as a rule of thumb, any patient over 40, I make sure that they get a PSA done, just to make sure we have a baseline PSA before they start finasteride.
PSA is a prostate-specific antigen just to check that you don't have any underlying prostate cancer or something like that. So if you listen to some YouTubers, they'll go into the facts that you need all these blood tests taken before, and, some of them could be quite prudent, like there could be different genetic polymorphisms that lead to a decreased testosterone in a person, okay? But this is why it's important to go to a clinician. We as clinicians don't need all these fancy tests because a lot of these conditions can be elicited by a simple history and physical examination. So guys, you seriously don't have to go for all of these robust tests. Just go see your clinician and make sure they do a proper examination on you. And if you're over 40, a PSA, as Eric said, and you're ready to start finasteride.
I think if you've got all the money in the world and you want to do some extra tests, I've compiled the list for you. It'll be right here. Take a look at those.
In summary, finasteride combined with hair transplantation is the most effective and robust way to restore your hair loss. And we've seen some astonishing results with just these two modalities.
Thank you so much for listening. In our next episode, we'll delve deeper into finasteride side effects, alternative dosing methods, and also post-finasteride syndrome.
Thanks for listening, guys.